Customizing Phaco techniques for safety and efficiency. During my transition to Phaco, I learned and developed techniques to improve my skill and armed myself with powerful tools to deal with hard cataract and other complicated cases. I have many followers in Thailand and countries I had visited using these techniques. I still teach these techniques to my residents and will be very happy to talk about them today. One of the key technique that allow me do Phaco in hard cataract and other complicated cataract is the bevel down Phaco. Bevel down is a balanced force grooving. In bevel up sculpting, forward force may induce stress to the zonule on one side. Unlike bevel down grooving, the downward force will be countered by 360-degree zonule, so it is balanced. In bevel up Phaco sculpting, impact force is determined only by US power, so we have to increase US power with a harder cataract or change Phaco tip to a sharper one, which may compromise by less occlusion during segment removal. In bevel tip down Phaco aspiration, impact force is equal to tip impact determined by US power plus holding force determined by vacuum. We can increase vac and or US power when we face with a harder cataract. Emulsification is enhanced by vacuum. Less US energy is needed. This animation demonstrates the function of US power and vacuum. When we hit someone's face, his head will bounce away and he may not hurt much. This is similar to Phaco sculpting. But if we use another hand to hold his head and hit again with the same force, this time, he will hurt more. This is similar to Phaco aspiration. These are functions of the US power to hit the nucleus and the vacuum to hold the nucleus against the hitting force. Bevel down grooving has benefit of endothelial protection as the US energy is projected downward. Bevel down works safely close to or under the iris in small pupil or floppy iris IFIS. Technique to groove the nucleus with bevel down. We start from proximal part, overlapping each circle like Olympic rings. Gradually going deeper and deeper. Cover the desired groove shape. In a hard nucleus or a loose zonule case, we may apply a Sinskey hook to stabilize the nucleus. At proximal 2/3 of the groove, there is some occlusion, with low vacuum build-up. This part utilize Phaco aspiration concept. After making a deep groove at the proximal part, we continue to make the groove longer and longer at the distal 1/3 with no occlusion. This part utilize Phaco sculpting concept. This animations demonstrate how we bevel down grooving, using vertical Phaco aspiration at the proximal 2/3, and vertical Phaco sculpting at the distal 1/3 of the groove. We call vertical sculpting because if we view it in a different angle, it is a true sculpting action. This is a very hard cataract. Bevel down grooving starting close to the incision to make a deep, wide, and long groove. In bevel down Phaco, the Phaco tip is moving downward, not forward. We can see that the nucleus is very steady while we make the groove. The rate of moving downward must be equal to the rate that the Phaco tip can emulsify the nucleus. So there will be little downward pushing force. During bevel down grooving, we use 50 to 60% US power and low vacuum of 60 to 120 mm mercury. A Sinskey hook is used to stabilize the nucleus by apply a gentle force toward the nucleus. The groove width is approximately 2 tip wide and the depth will be 2 tip deep or more. We will learn how to recognize a proper depth later. After making a nice deep, wide and long groove, we can crack the nucleus into two halves using 3D cracking concept which will be discussed later. The two halves will be chopped into smaller pieces and removed. The Phaco tip will be rotated sideways during chopping and segment removal. Let's discuss more about the groove. How deep to go? The depth that we aim for is the interface between the hard core nucleus and the soft outer shell. This is where the Y suture located. The interface at this depth is loose, so Phaco tip will aspirate and lift the last layer up and we can observe a smooth floor behind. This is called the changing consistency sign, when the floor becomes softer and looser and the nuclear lamella or block is lifted up, leaving a smooth floor behind. Look at this video. Observe the changing on the floor, which will suddenly smooth when last layer of the inner hardcore nuclear lamella is being aspirated by the Phaco tip. This sign is very characteristic and reliable to use as an endpoint for depth. We can also observe the posterior Y suture at the floor in this case. To learn how much floor thickness remain. After cracking, the nuclear segment is turned up to observe the floor thickness that left after we reach the final depth. The floor thickness in this case is approximately 1 mm. Beginners may confuse because there are many Phaco techniques invented during the last decade. No technique is good for all type of cases or surgeon or machines. So how to select a proper technique? On day 1, the first technique was the nuclear subluxation and remove nuclear rim. Success was limited because large and hard nucleus were difficult and might not safe to sublux. The divide and conquer technique described by John Shepard and Hovar Jimbal in 1990 and introduced to Thailand by Paul Ernest in 1991 was the first technique that brought success to hard cataract, but grooving may consume time and energy. Phaco chop with no groove in hard nucleus might be difficult to disassemble into completely free segments. After some trial and learning, I found that combining groove and chop is best for hard cataract, and when combined with bevel down grooving that save time and energy, the efficiency and safety can be improved. I will discuss more about nuclear disassembly techniques and the bevel down grooving. Let's look into some details about nuclear disassembly techniques. This is a good time to introduce the concept of direct and indirect nuclear fiber separation. In the Phaco chop, we see that the action of the chopper is from the periphery inwards to the tip, represented here as the shaded area. These fibers are directly cut by the chopper, hence the term. As well, the Phaco tip that we impale into the nucleus also cuts fibers directly using ultrasound, and this is a separate sort of direct cutting. But look at this representation of the nucleus in cross-section. We can see that the chopper only cuts the anterior 25% of the nucleus directly. The posterior 75% is separated when we apply separating force on the anterior edge, and this force is transferred posteriorly to separate nuclear fibers, a maneuver that most of us call cracking. Since we're not directly contacting the fibers that we're separating, we consider this cutting to be indirect. The more anterior you make your chop, the more lens remains to be cracked posteriorly, shown here as the unshaded area, and the stronger the force you need to achieve a separation. What can we say about the divide and conquer technique in terms of direct versus indirect cutting? Most of this technique involves direct cutting using the Phaco tip to sculpt the lens. The remainder of the lens, shown here, is indirectly cut when you apply the force for cracking. In terms of safety, in a very hard nucleus, once you've made a groove, you have already destroyed most of the lens fibers before you crack, and so this technique is very good for breaking up these lenses. But the downside is that you have to take some time to make the groove, and this can take a lot of time, as we all know. But in terms of safety it is preferable, since nuclear separation will be easier. In stop and chop technique, some area of the nucleus is directly cut by the US tip during sculpting and more during stop and chop, which make the following cracking step easier, using less force. The three ingredients, groove, chop, crack, can be put together in different formulas to create different techniques. These techniques have good points with some situations and may not appropriate with some situations. They also depend on surgeon's preference. These techniques line up in a spectrum depending on groove's characteristic. Divide and conquer with a cross groove, stop and chop with a long groove, stop and chop with a short groove, Phaco chop, quick chop, pre-chop without any groove. What is the different, similarity, or benefit of these techniques? After making a deep and long groove, the two instruments are placed in the middle of the groove closer to the surface. When the force is applied, the nucleus will be cracked from top to bottom, and the floor will remain uncracked. In the second stage of cracking, the two instrument is placed at the distal end of the groove closer to the floor. When the cracking force is applied, the nucleus will be cracked from periphery to central. Repeated cracking from periphery to central in another direction will complete the separation. "3D cracking technique" is a cracking technique that apply forces in a specific pattern, vertically and horizontally, to separate a very hard nucleus with minimal forces. 3D cracking concept can also be applied to chopping maneuver. Bury the tip close to the surface and chop. Follow by top to bottom cracking step. The hook is inserted periphery along the initial cracking line. Periphery to central cracking step. The hook should be applied few times, more central, along the cracking line to complete the separation. This is a very hard cataract. Using bevel down grooving to make a deep, wide, and long groove followed by 3D cracking, top to bottom or vertical cracking and periphery to central or horizontal cracking to complete groove separation. Then we will rotate the nucleus and chop into smaller segments using the 3D concept chopping to separate the nucleus with minimal force. Strategies for a hard nucleus. Minimize zonular stress. Large capsulorhexis. Minimal hydrodissection. Deep, large, and long groove. Bevel down Phaco. Complete nuclear separation. Endothelial protection. Heat prevention, torsional US, energy modulation. Triangular cracking technique is my favorite technique. It is one type of stop and chop technique and it is best for medium or medium to hard nucleus. This technique has many good points. Since hydrodissection is not critical for this technique, the beginner who cannot do a good hydrodissection can complete the surgery without a rotation problem. This rotationless technique is also good for a loose zonule case since unbalanced rotation can damage the zonule. Starts with bevel down Phaco to make a triangular bowl. Chopping left corner. Chopping right corner. Without any nuclear rotation, the first segment is ready for removal in front of the tip. The segment can be pulled easily toward the central safe zone since the triangular space provide enough room. This is a minimal rotation technique that require minimal hydrodissection. Auto hydrodissection will also occur while we do chopping maneuver. The apex of the triangle is mechanically cracked. Further chop and removal. For a soft cataract, we need a narrow base triangle so the two corners at the base will locate in harder zone resulting with easier separation. For a hard cataract, we need an extra chop in the middle to divide the nucleus into smaller pieces. This is a triangular crack in medium nucleus. Removing the epinucleus to expose a harder part. Follow by bevel down Phaco to make a triangle groove. Groove depth endpoint is observed as the floor becomes smooth. Then we chop left and right corners. Without any rotation, the first segment can be removed. Then we crack the apex and rotate the nucleus for further chop and remove. Comparing the technique in medium and soft nucleus. We make a narrow base triangle for soft nucleus. After remove the first segment and crack the apex of the triangle in soft nucleus, we may remove the remaining nucleus without further chop. Bevel down and triangular cracking are my technique of choice for a loose zonule because they minimize zonular stress. Strategies for loose zonule. Minimize zonular stress. Large capsulorhexis. Hydrodissection. CTR. Complete nuclear separation. Triangular cracking or supracapsular phaco. One-step IOL insertion technique. Posterior polar cataract is another situation that gain benefit from the triangular cracking technique since we can complete the surgery without a hydrodissection. Very soft nucleus may be difficult if using inappropriate technique. Soft nucleus is not easy for beginner if an appropriate technique is not used, because it will be difficult to rotate and disassemble. Good technique for soft nucleus should not depends too much on cracking and rotation. Stab test is a tool to verify the nuclear softness. Before hydrodissection, the cannular is stabbed to the middle of the nucleus. If the cannular can reach the middle of the nucleus easily with no resistance, the nucleus is very soft. If there are some resistance, the nuclear pushing is observed, the nucleus is soft. If the cannular cannot get into the nucleus is not soft and is not good for the techniques that we use for soft nucleus. In very soft nucleus, it will be easier to subluxate the nucleus out of the bag using hydrodissection and remove with aspiration. Please note that the rake's size should be 5 mm or more and not for posterior polar cataract. This is a very soft cataract. The cannular can travel into the nucleus without resistance. Then we continue with hydrosubluxation to push the nucleus out of the bag. The soft nucleus can be aspirated easily outside the capsular bag. In soft nucleus and loose zonule, it will not safe if emulsify and manipulate nucleus inside the bag. With hydrosubluxation to put the nucleus into the supracapsular space, manipulation will put less stress to the zonule. The capsular tension ring also used in this case. In conclusions, 8,760 days of learning and teaching Phaco. The most important things that I've learned and helped me overcome difficulties are grooving in hard nucleus, using bevel down Phaco and looking for the changing consistency sign for a proper depth. Nuclear separation using 3D cracking concept. My favorite triangular cracking technique for medium nucleus. Developed strategies for various type of difficulties, hard nucleus, loose zonule, small pupil, soft nucleus. Thank you very much.